any, consciousness. This is why in Taharruk, I created a condition called Al-Rashideen system. Al-Rashideen system is talk about mindful eating, about conscious eating. Because most of the time, we sit in front of the TV, we keep eating. Snacks, we eat, available all the times. We are on the move, we eat. And without knowing that, do we need the food? No. We eat as well according to the timing. Breakfast, lunch, dinner. Our ancestors, they used to live longer, they were more fitter, there was no medicine at the time, and did you have any diseases like us now? Look at us now. Diabetes is going up. Diabetes is the second cause of stroke. So if you have hyperpressure diabetes and smoke, you are just awaiting a stroke around the corner. This is why, we have, and all these diseases are controllable. Smoking is your will, you can stop it. And it is wrong, it can cause cancer, it can cause a lot of things. But the most important thing is stroke and cardiovascular problem, heart disease, so you can stop it. High blood pressure, you can control it by eating the healthy food, and you need to check it early. Unfortunately, we don't check our blood pressure. We have to check our blood pressure, and I put a protocol for people to check blood pressure in our communities from the age of 30. Not to wait, I'm going to get older at the age of 60. You need to start earlier to check your blood pressure. Because I have seen blood pressure, high blood pressure in people in 20s. I was in Africa, I traveled a lot there, and I've seen people come with a stroke at the age of 30s. People with renal failure, and they're coming as that with the blood pressure. So really, and then after the age of 40, you need to do it, to check your blood pressure every 6 months, maybe every 8 months, and at the age of 50, every 3 months. After 60, you have to check your blood pressure every 2 or 3 months. Because blood pressure could be going there. Blood pressure just doesn't really come suddenly. It's not going to be like you turn 65 and then your blood pressure comes. No, it gets built up from early childhood. And we talk about, and I wrote a book about prevention at birth, and I talk about breastfeeding. And breastfeeding, lack of breastfeeding is the cause of disease at a later age. And even now we can see the problem of autism and other problems, ADHD. All these problems are due to lack of breastfeeding. And I've seen it, proof in some families who they have children. I've got one of my friends, got 6 children. He's got autistic child and another child with trouble. And these two, they didn't have a good breastfeed feeding for the recommended time as per Quran, 2 years, 30 months. His 2 daughters are very bright. One of them is a doctor, is a medical student. Another one is quite bright at the school. They both breastfed for 30 months, while his 2 other sons, one is autistic and the other one is got troubles, they haven't breastfed for that time. So this is what I feel, there is something there. This is why we see it there now. Plus some additional factors, we have the industrialized food, the fried foods, and all these deliveries, all, as I mentioned it here, that is طريقة الإهمال يقودك إلى المرض, negligence or the mistakes will take you to disease. That is unhealthy food, and we talk about unhealthy food lead you to, you can see that unhealthy food lead you to obesity. What's the problem? And obesity will move you to insulin resistance, and insulin resistance will lead to diabetes and high blood pressure, and fatty deposits, and then this will lead to تصلب الشرايين, or a condition called arteriosclerosis, or narrowing of your blood vessels. And when you get narrowing of your blood vessels, then you develop these clots. Our body develops clots all the time, and these clots, when it become too much, it can't travel through the small blood vessels, and then lead to obstruction and lead to the death of the cells and give you the symptoms of stroke. Yeah.
So these can cause stroke, cholesterol, and heart blood. If somebody already has gone through it, can this be reversed, or it cannot be reversed?
Yes, if you come within time. This is why I said the golden hours are very important. 4.5 hours is very
Once
important.
the person has gone through it, is there a way to recover after that?
After that, yes, because with the stroke, you can't talk, so you can't communicate, you can't swallow, you can't move. So you get the complication. This is why we still treat people, because you have complications. People, they can't swallow, the food will go to the wrong pipes. We have 2 pipes, the breathing, trachea, and we have behind it esophagus, which is the pipe taking the food going down to the stomach. So we have to protect that, because with the stroke, there is a valve which is controlled. It closes the frontal pipes and lead the food to go. If I drink now, it will go through the esophagus, and the valve will cover the front pipe, the trachea, so that it doesn't go into the lungs. But if you have a stroke, this process gets disturbed. Subhanallah, and swallowing, we have almost, I think, so many muscles which involved in swallowing, because it starts from your lips, you have your cheeks, you have your tongue, and the muscles around your mouth, quite many of them, they are involved to control that swallowing to go to the right side. So people, they die because they have aspirations, because what we call aspiration pneumonia, so we call like chest infections. So it becomes very severe, and you have a stroke, you are lying in bed, you can get clots.
Something I am talking about from experience. I worked in Saudi for a long time, and in research center, the percentage of people in Saudi Arabia who have diabetes. Anybody can give a percentage? 80%. Think. Where's the girl who used to answer the questions? In the back. 25% of the population in Saudi Arabia have diabetes.
Well, that is a diagnosis.
It went diagnosed, undiagnosed probably. More. In the UK, it's about 10% maximum.
I think it's more than that.
Yeah, it's we are talking about that type 2 diabetes.
Yeah.
So the other point, if smoking is high in every community, in every society. I mean, if you go to the airport, there is a room, you can see people queuing to go into the smoking area, and everywhere, even in hospitals around the world. So the question is, I mean, people would ask, if I'm a smoker for a long time, if I stop smoking, quit smoking, would I have my chance of diabetes, stroke reduced?
Yes, smoking is really quite, and I always tell people one day who smokes, you have like a double diabetes as well as hypertension. I always, I feel smoking really is a big cause of many vascular problems, heart or brain disease. And smoking, it takes 5 years, your body to become back to normal. So the sooner the better. This is what I always tell people. Don't say I'm going to do it, or it's like to be a New Year pledge or something like that. No. I'm waiting for January to do it. No, you do it now. And I think for health, I always people. This is why I put the word تحرك. تحرك is a really good word, and تحرك is tell you everything. تحرك today, not tomorrow. تحرك today, and as well تحرك, move today as well. Move, start your health lifestyle. You start your movement. You start your to walk. You start to change your lifestyle. You start a kitchen. You have to change things. Kitchen. And smoking really, you know, people who smoke earlier, it's really quite bad. You know, communities, you know, in the Middle East, still there, smoking is really bad. I don't know, in Asia as well, it's still there, and Africa. And as well, you know, we don't have the measures. People just smoke in the transportations, in cars, inside, you know, restaurant and closed spaces and something like that. Even those, the government say, oh, we have to stop smoking into closed places, because, you know, passive smokers are the most people who are really get affected more than the active smokers. Yeah, but smoking really is one of the worst invention by human.
Okay, I have a question.
Yeah.
Regarding the cholesterol and diabetes, if you have this is for 8 years, 10 years.
Yeah.
What is the test that you need to say تصلب الشرايين? Which level you reached if you are not doing any activities, you are not doing all these things? Is there a test that you can do and see the percentage of the stroke that you need to be? Because in the GB told us no need to take
Cystatin.
yes, Al-Rashideen.
Yeah,
because
yeah.
in the coming 10 years, your possibility is 10%. How they calculate these things?
Yes, they calculated. I think according that's going to. I'm going to ask Torias is going to answer that about it. But you know, regarding stroke, regarding cholesterol, you know, some families they have high, called hyperlipidemia, called familiar hyperlipidemia. They start at the early age because that they have genes problem and your body just make more, because cholesterol it comes from outside and from inside. So our liver make cholesterol. Some people they have accelerated, so they have higher percentage of manufacturing cholesterol in our body. And by the way, cholesterol is very important for our hormones, especially ladies' hormones, females' hormones are all coming from the cholesterol. Or all sex hormones are coming from cholesterol. So cholesterol is important, but it needs to be in a certain quantity. You know, everything is optimum. It's supposed to be, you know, give us the right function of our body. But at certain level, if it starts to become high, then we will have the disease. But it's not going to be on its own, because if you have only high cholesterol, it's going to be a factor in giving you stroke or heart disease. No, it could be hypertension, diabetes, family history. All these, they're all multiple factors. But this is why I always say, if you have smoking, if you are a smoker, that's where you get, because I have seen people with just smoking only coming with a stroke, because smoking is quite dangerous. Because smoking, it affects the blood clots, makes the blood thicker. It causes damage in your arteries. So it gives you everything about diabetes and hypertension, and the cholesterol as well. Yeah. So I will tell you, I'll give back to Yassir so that he can give you about this, how they calculate it.
Yeah, it's for cholesterol. There are two types of cholesterol: high density lipoprotein and low density. So there are good cholesterol and bad cholesterol. So the bad cholesterol, if it's high, you have to worry about it. But it's the other thing is you reduce weight and cut off unnecessary fat. So it's something that you can't control. One question I would just address, Dr. Jum'a.
Yes, about the
cholesterol.
No, about the GP told him about this percentage in 10 years time. You know, the predictability of Fleming.
Yeah, there is a
formula.
A formula that would give weight, cholesterol, lack of exercise, diabetes, and the age. So at the age, what they do, the possibility of having fatal or near fatal heart disease, that means either stroke or heart attack in 10 years time. So if it is more than 15%, then you have to do maximum effort to reduce it by any mean. So if it is less than 10%, it means general population between 5%. So even if you are fit, I mean, one can expect to have a heart attack, isn't it? So
Yeah, but I think the question he wanted to know how we calculate it. But I
we
think
calculate, there is a formula. It's called risk factors. So if you just feed the 5 questions, they give you it's more than 5% or less. If it's less than 5%, the general population is less than 5%, so you don't have to worry about. But if you do it on monthly, yearly review, so if it is the cholesterol is high, diabetes is still high, so the formula would give a higher number. So that's the risk factor. So you can do it yourself on the free website on this, so you don't have to worry. I'm just going to answer just Dr. Jum'a. He mentioned the tayyibat. Every day probably I get questions. Can I follow tayyibat web formula or way of diet? Well, everybody is entitled to do whatever he likes. What I don't agree with, I mean, Dr. Diya Al-Awadi, Allah yarhamu, he mentioned a few things. I mean, if you don't take eggs, don't take baqul, don't take sugar. You take sugar, but it's up to the people. But what I mean, medical opinion is against. Is said, leave every possible treatment that you are taking, even the insulin.
Yeah.
If you are dependent on insulin, which is it's a crime if you leave everything and just he mentioned that it's even cancer is caused by what you eat. It's not true. So do whatever you like, but don't leave the treatment that you are taking. I mean, especially it's mumayyaat al-dam, it's thinning blood. This is if you don't take it, that's it's something that's very serious consequences might happen.